Dr. Charity Evans and Dr. Hillman Terzian, both responsible for the care of Governor Pillen. I want to remind you that the answers they provide are going to be solely related to the care the governor is receiving. So if you have any other questions outside that scope, feel free to speak to the governor's office. They should be able to help you with that. We're going to start with questions from all the media here in the room, and then after that, we will proceed to the folks on Zoom. Again, we do remind you, if you are on Zoom, to please remain muted until you're ready to ask a question. At that point, come off mute, ask the question, and then go back on mute when you're finished. So we're going to start with Dr. Charity Evans, who can then introduce Dr. Terzian after that. Thanks again for being here.
Good morning. I'm Dr. Charity Evans. I am Chief of Acute Care Surgery and Trauma Surgery here at Nebraska Medicine, and feel fortunate to be here with all of you this morning. I'm very thankful to be able to provide excellent care to the governor and to support him through this injury, as we do thousands of patients each year here at Nebraska Med at our Level 1 Trauma Center. It's my honor to introduce my colleague and partner, Dr. Hillman Terzian, who was providing excellent care to the governor last night and into this morning. So we'll go ahead and get started.
Good morning. My name is Hillman Terzian. Yesterday afternoon, we received the governor in our trauma bay. He was conscious on arrival and in stable condition. He had several injuries, which we promptly addressed. He had a spleen injury as a result of a horseback riding injury that he received. And we recommended what's called a prophylactic embolization through our interventional radiologist. And what they did was they performed a minimally invasive procedure where they passed a wire into the arteries near his spleen, and they put some coils there to stop the bleeding. And he did very well during that procedure and has been stable the entire time. He also had a minor kidney injury, which will resolve on its own, we're confident. He also had a minor fracture in one of his vertebrae in his back, no damage to his nervous system, and no signs of any head injury or any injury to his spinal canal. So his nervous system has been intact, and that injury should resolve itself on time as well. He also has 7 rib fractures on the left side, which is actually can be a very painful injury to have, and can predispose people to not being able to move due to the pain. They can have complications from that, but I've been very pleased with his progress overnight. He has been very, very motivated to get out of bed. I was telling Dr. Evans he's a doctor's dream in this sense, because I wish more patients were as motivated as him. He's already been walking laps, which is very impressive. When you examine him and you talk to him, he's a tough guy, and that shows with the way he's recovering so far. And so I'm very pleased with that. He is in our intensive care unit right now, which is our normal practice for people who have a spleen injury to that degree, as well as people with rib fractures at his age. However, he's doing well enough and he's stable that we expect him to probably leave the intensive care unit sometime this afternoon. He will be in the hospital for at least another day, if not longer, mainly to make sure that his rib fractures are addressed. Because as I said, that they can be very painful, and over time, we have to make sure that he can breathe and function normally. But so far, he's doing that, so we're optimistic. And we think he has a very good prognosis.
What are some major side effects that you're looking for when you have this combination of a hard fall and surgery?
Sure. I mean, so anyone who falls, the most obvious concern are head injuries and spinal cord injuries, of which he has none. And the biggest thing with the spleen injury that he has is making sure that he stops bleeding. And he did have some active bleeding before we did the interventional radiology procedure, but that evidence is that it's stopped. So that's our first thing. And then with the ribs, the biggest thing we're looking for is ability to function normally, to be able to take deep breaths, to be able to walk around. We don't expect anyone with his injuries to be up and running a marathon the next day, but we like them to be out of bed and to show us that we can pick up small objects, that sort of thing. And that's what we're looking to make sure that no one backpedals in that sense. But so far, he's just moving forward. So very good news.
Can you take us through the timing of the injury and when was he in Columbus and when was the decision made to transport?
I'll have to defer to his office about the actual injury because I don't know. He was in Columbus that afternoon, and they requested that he be transferred here because we're the Regional Level 1 Trauma Center, and he arrived around 4:40 p.m. here. But it was a very quick transfer, from what I understand.
Oh, go ahead.
Ribs, how long do they typically take to heal? How long is it likely that Linda starts moving around?
So ribs usually take about 3 months to fully heal. You don't have the same symptoms for the full 3 months, and usually people do better over time. We have options to explore if he's having ongoing pain that he feels is limiting his ability to function normally. Some of them are operative, but they're essentially elective, or not necessarily elective in the sense that it's outpatient, but elective in the sense that it's optional, and can help with recovery if someone's having ongoing pain. So far, he hasn't expressed that he's having that degree of pain, but we have options, and that can help your recovery if you're limited by pain.
Our biggest focus right now is that pain control because we want him to have adequate respiratory function. I think the other thing is he's an active person, and so we want to return him to that active lifestyle, and so that will guide some of our treatment options as we move forward over the next day.
I'm assuming he was knocked out, incapacitated for the surgery, and how long was that for?
He was sedated for the procedure. It was under an hour.
At this point, in his recovery, are you expecting any more surgeries at this point that you have planned?
As of now, we are not planning any other operations. However, we have operative options for his ribs if he feels that his ribs are incapacitating him in some degree. It's a somewhat subjective. There's objective components and subjective components. It's largely subjective, and from a subjective standpoint, he is very motivated right now.
How concerned are you about the back? You said you called it minor, but I know a lot of times that's a very nuanced area.
Yeah, it is. Technically, it's what we call a transverse process fracture, which we treat non-operatively, and there's generally there are no long-term problems associated with it.
Any idea on timeline of most likely discharge? You said a little bit about maybe as early as Christmas Eve, but it still depends on the recovery of the ribs. Is that?
Exactly. So we'll obviously watch very closely through tonight, continue to encourage him to ambulate and to work with his respiratory function. If things are going well, we can look at discharge over the next few days, and then again that decision whether or not to actually repair and stabilize the ribs. If we do move in that direction, if that's what he elects for, then it would be another day or so of hospitalization. But really, as mentioned, he's very motivated. He's an ideal patient, and so I suspect that his hospitalization will move along quickly.
Have you had to tell him to I know you're the governor, but could you settle down a little bit?
Yeah, he wanted to be out in time for Monday Night Football, and I said, I bargained a little bit, push it to Tuesday night, and I said, well, let's see how you do. But I told him he had to get to a chair, and then I checked on him about an hour later, and he'd already walked 6 times up and down the ICU. So we're going to do the right thing for him, but he's ready to go.
He's also actively recruiting our resident physicians to remain here in Nebraska, so
Yeah.
he's doing his job from the bed. It's great.
Yeah.
Do you know if he would have been wearing any protective gear at the time of the fall, or just standard, jeans and boots on a horse?
I don't know anything about what he was wearing because when he came to us, he was already in a hospital gown. But his injuries usually aren't prevented by protective gear. If he had a head injury, that might be different, but he has no head injury.
On the vertebra, can you say where the lower
It's a lower lumbar spine, L1, transverse process fracture.
Let's open up to Zoom now. If there are some folks who are on the Zoom that would like to ask questions, come off mute, ask your question, and go back on mute when you're finished.
Thank you all very much.
Okay, sounds like
Thank you.
we have no Zoom questions. If anyone has any other questions? Okay, just want to remind you that the governor's office will be putting out a statement shortly, so anything not related to his medical care, they will be taking care of. Thank you for coming today.
Thank you.